about myself. I have a background in nutrition and behavioral sciences, and I have been in the field of health and wellness for almost 18 years now, working with various organizations, corporates, doctors, community programs over the years. And eventually I got certified as a health coach as well as certified through American College of Lifestyle Medicine. So I know that sleep is an important topic for all of us, and I hope to give you some information that will help you. So let's get started. Give me just a moment here. All right, so I just want to get a feel of what is motivating you to be here, spend this afternoon with us. If you can quickly chat some, or even share with us what would you like to take away from our session today?
Feel free to unmute yourselves and speak. Steve, I think you're on mute. Sorry.
Well, we all need tips on. None of us are immune from these lifestyle habits, so I hope to pick up some tips myself, and also learn more deeply about the different parts of sleep. It's much more complicated than we realize.
Well, just Dr. Ralph and I work pretty closely as well, so happy to have you here.
Good to be here.
All right. So let's definitely sleep is something we all, there's a lot of unknown about it, and let's see what all we can cover today. Now, in terms of, I'm going to go over first the importance of sleep, or why is it that we take it so seriously. Its biggest impact is on our brain, and so 2 to 3%, although brain accounts for just 2 to 3% of our body weight, it consumes almost 20 to 30% of the energy. And we need to allow that sleep allows for our brain to replenish that energy. It also helps in our focus and alertness. Now, when we have to make those decisions in split seconds, especially for mundane activities like driving, lack of sleep can increase the amount of time we take to respond to those situations. And so it's astounding that 1 in 5 car crashes take place because of a drowsy driver. It almost accounts for 7,000 deaths per year, and the amount of disability that it causes from car accidents is far more than just the number of deaths. So its impact can be huge on activities such as driving, but also for athletes in their sports abilities or their ability to take those actions quickly. Now, something new that we are finding about sleep is that it helps us clear out certain toxins that we accumulate in our brain over the day. And so one of the toxins that in fact, 2 toxins have been found to have close association, which are amyloid beta and tau protein. Now, these toxins accumulate in our brain, and our lymphatic vessels, or those are responsible for clearing these toxins out. These are very active in the night, and when we get to stages of sleep and more discussion on that, we'll talk about the exact timing when this takes place, but these toxins are cleared out. If we do not allow ourselves to get that enough sleep, then these toxins can accumulate, and there is high correlation between diseases such as Alzheimer's disease and presence of these toxins. So for us to avoid those conditions, we do want to get that good night's sleep. Now, as we go through our days, we are kind of building a story in our heads. Imagine there being multiple sticky notes on a wall, and we are kind of, every night, we are associating our experiences of that day with what our experiences have been in the past. So we are kind of reorganizing those sticky notes every day, filing away important information. And if we are not allowing ourselves to have that sleep, that information consolidation doesn't really take place. Our associations of things can be disrupted. And so it really doesn't serve us, especially for people who are trying to gain new skills, for students who are trying to learn new information on a day-to-day basis. We cannot really retain the new learning well if we are not allowing ourselves to have that good night's sleep. Okay, so you have your lunch in the afternoon, and then you naturally feel drowsy. There is a compound called adenosine that develops in our brain that is responsible to transition from being awake to involuntarily getting more sleepy. If you have had your lunch in the afternoon and you're at work, what's your natural way or normal way of handling that? What do you normally do at the time? Anybody?
Have a cup of coffee.
Exactly. A cup of coffee. Now, what coffee does for us is basically it acts as a blocker to adenosine. What that means is our brain cannot recognize that there is adenosine. It's not that it's not present, but it just doesn't identify it. And so we are really putting a Band-Aid on the wound and not really taking care of the cause of the wound. So having that coffee doesn't really do much. Instead, having a good night's sleep may not need you to have that coffee. Now, it is interesting. Many years ago, I was conducting a workshop at an organization on stress management. And one person comes up to me and asks me, ma'am, I really consume around 12 one-hour-a-day drinks, and I still cannot focus. Is there anything stronger that you can recommend me? And I asked him, how many hours of sleep are you getting? He said 3 or 4. And my natural answer was, your body is craving for that sleep. You don't need so many 1 hours a day. In fact, it can really be hard for you in terms of your blood pressure, heart rate, all of that. It's not recommended. You would rather need to have proper sleep. So we are really trying to find those quick fixes from caffeine and ways to manage our tiredness instead of allowing ourselves to get that good night's sleep, which is detrimental. How else sleep impacts our body? Now, our heart really works hard through the day, and in the night, we are allowing it to rest. That's when our heart rate drops, our blood pressure drops. However, when we are, when we avoid taking that sleep, our heart doesn't really get that time to recuperate and recover from a lot of hard work through the day. On the flip side, we have also seen that people who have high blood pressure, almost 30% of them tend to have some issues with their sleep. So if we correct their sleep issues, then they might not have concern with blood pressure at all. So if you're one of those who is on blood pressure medication, you want to look closely at how well you sleep in the night. Immunity. Now, many of us are trying to get our COVID vaccines right now, right? And in the fall, we try to get our flu vaccines. We are now learning that it does take 2 weeks for our body to create enough antibodies to give us protection against that virus. However, when a person has not slept well, the number of antibodies that we produce is much lower. In fact, one study found that even one night of less sleep in those 2 weeks can reduce the antibody production by almost 40%. So that's a significant reduction in the protection our body can get if we are not well rested. Lack of sleep is also associated with higher inflammation, and higher inflammation is associated with cancer in our we are still learning a lot more about this correlationship, but the probability of preventing cancer by good night's sleep seems to be pretty high. And so there seems to be some promising information there. However, we are still learning more about it at this time. Regulation of appetite. Now, we tend to, a lot of people that tend to eat perfectly healthy during the day tend to get 70% of their calories late in the night. Human beings are the only organism or the creatures that voluntarily choose to stay up later in the night. In animal kingdom, if we look at it, there are only some big cats that tend to be awake for longer than regular, and that's only when they do not have enough food, when they are still hunting for their prey. Certain cats can tend to be awake for almost 72 hours. But what is happening for them at that time is their hunger hormones are really high. And so also the level of certain hormones that trigger satiety for us, that we are full after a meal, are pretty low. Now that same hormonal imbalance is mimicked in our body when we are up in the night. So we are hungry and we are not as full, and so we are looking for food. But here we are voluntarily choosing to stay up despite having a full tummy. So we are eating more, we are not satisfied, so we tend to overindulge. And guess what happens the next day? Because we are not well rested and more tired, we tend to look for that quick energy fixes. What we tend to normally eat for those quick energy fixes is sugar, fat. We need it now. And so overall, we are looking at higher incidence of obesity that is associated with lack of sleep. Our fat cells also need rest. When we compare the amount of glucose used by fat cells that are from a person's who is well rested versus a person who is not, the use of glucose is much lower among those who are sleep deprived. And so all that sugar remains in our blood, and our prevalence of diabetes is higher, or pre-diabetic-like conditions are created. So if we look at the prevalence of obesity and diabetes across the years, with the change in amount of sleep we are getting over the years, we see a direct correlation there. And so there's good likelihood that lack of sleep has led to higher obesity and diabetes among us. Now, certain conditions, emotions also have a lot to do. And I'm sure all of us have experienced that. When we are not well rested, we tend to get more angry. We tend to get more fidgety. We tend to get more depressed. Unfortunately, sleep is the first thing that is impacted by depression. And it's the last thing that is cured when a person is getting cured of depression. So that we really need to make sure that a person who is depressed, if they tend to get sleep better, they might be quicker to recover. Suicidal ideation is also pretty high. And this is of particular risk among teenagers and young adults. The two most frequent causes of death among young teenagers and young adults is car crashes and suicide. And so if our young population is not well rested, if we allow them to have better sleep, then they are likely to not have as many incidences of suicide or depression. Okay. Now, sleep disorders, something we commonly associate with a person snoring, right? A person snores means like when we are trying to whistle, we are trying to create an obstruction in the movement of air. That's exactly what happens when we are sleeping and breathing. There's some obstruction that leads us to snoring. 1 in 3 person
has started
snores, whereas 1 in 6 women tends to snore. Now, in 65% of people who are snoring, there is certain sleep disorder, or there's certain obstruction of air. And for the rest 35%, it's mainly just that noise. But it is important to identify if it is just noise or if there's something more going on there. And the reason for that is the incidence of cardiac diseases or heart attacks is significantly higher among people who have some obstruction in their airways by sleeping. So that's something you want to discuss with your doctor if you do snore regularly. It is also a concern if you are getting 7 to 9 hours of recommended sleep, but yet you don't feel rested the next day. Then there might be something going on with your quality of sleep that we need to look into closely. Okay, so what are some reasons why people cannot sleep? Now, restless leg syndrome, it's an involuntary movement of our legs, but it can also be with your hands or other. And so, although the name so suggests for legs, it may be different for you. This involuntary motion may not happen every night. It may be more severe at certain nights versus the others. But if those are the concerns for you, you want to discuss with your doctor. Again, teeth grinding. Sometimes it's so hard, a person may grind their teeth so hard that they can wake up while sleeping. Again, a concern for that fragmented sleep. Now, pain and discomfort is a double whammy. It can keep you up in the night, but if you haven't slept well for 2 to 3 days, you can have aggravated pain and discomfort. So again, getting to the root cause of that pain and discomfort is important to address this. Caffeine. Now, most of us know that caffeine impacts our sleep. However, many of us don't know that caffeine can hang around in our blood from 6 to 9 hours. So it's important that you count backwards from your sleep time and avoid that caffeine for 6 to 9 hours before that. Alcohol is another one. We live in this culture where drinking, attending late night parties, pre-COVID time for sure, had been a norm. And now as well, we have seen with COVID, people are using alcohol highly to address some of the stressors that all of us are facing. However, alcohol can help you fall asleep. It can be a sedative. But once the alcohol digests, within 1 to 2 hours of its intake, there is a gush of glucose into our blood, which can wake us up and make it harder for us to fall back asleep. So it is important that you can monitor your alcohol use. Now, typically, it is recommended that for every drink of alcohol, you give 2 hours of time before bedtime. So if you're planning to have 2 drinks a night, you might want to have them 4 hours before bedtime so that it doesn't impact your sleep. Certain medications can also impact us, and this is definitely the case with certain antidepressants. So if you find, and given how much of an impact or how much of a correlation there is between depression and medication, sleep, you want to discuss with your doctor and get medications if you really need them, the ones that wouldn't impact your sleep as significantly. Now, our sleep is closely related to circadian rhythms. So when it gets dark, our body naturally produces this hormone called melatonin that induces sleep for us. Um, in absence of that darkness, and especially since we have so much electricity and light around us, it can be harder to produce that hormone for our body. This prevalence is even higher now with the prevalence of blue light all around us. Our various gadgets, from phones, laptops, iPads, all of these emit blue light, and that interferes with our body's natural production of melatonin that is supposed to induce sleep. So it is recommended that we avoid any of these blue lights at least 30 to 60 minutes before bedtime. In other words, you want to keep all your gadgets in another room, let them recharge, give your body time to recharge for the next day. Okay. Now, menopause is commonly associated with sleep disorders. Each woman responds differently to menopause. You do want to, often weight gain is associated with menopause. Even among those women who do not gain weight, there is collapse of certain muscles, which may lead to sleep apnea or breathing concerns when sleeping. So be mindful of this. Make sure that you are sleeping well to reduce the impact of changes that occur in our body from menopause significantly. Many of us get up to use the restroom in the night. Let's talk about how often is a good amount. If you wake up once in the night, that's okay. But if you're waking up twice, that is okay, but not the ideal situation. Anything more than twice in the night is something you want to discuss with your doctor, because there could be other factors that are playing a role over there. Okay, other benefits of sleep. People tend to look way more attractive when they are well rested. This was an interesting study done among medical students. A group of them were who got good sleep, and a group of them who were not well rested. Now, their portraits were taken, and in both of those cases, the participants would shower, get dressed, their portraits were taken, and people were asked to rate how attractive a person is. Within 4 seconds, those who were well rested were identified as more attractive as compared to others. So you want to look beautiful or handsome, you want to get your beauty rest. Also, another study, a very interesting study, looked at what are certain experiences we recollect more of when we are rested versus we are not. And it was found that people who are depressed, who are people who are not well rested, tend to remember negative experiences way more than the positive ones. And so imagine this: you're depressed, you are had lack of sleep, you're tired, and you're still remembering all those negative experiences more. Your depression is going to aggravate. Your outlook towards life is going to be much different than if you were well rested. So it definitely is worth investing that time in getting good rest. Some other red flags. I'm okay with 4 to 6 hours of sleep. No, most of us need 7 to 9 hours of sleep as an adult. I don't need sleep. Well, if rats do not get sleep for 2 weeks, they definitely die. There is a condition called prion disease among human beings as well that occurs in their in midlife, somewhere in 40s and 50s. It's a protein in our that can be a protein that does tend to mutate, and that leads to this disease. Um, People who have this disease, 1 out of 4, people tend to die within 4 months of having that disease because they cannot sleep in the night. So definitely sleep is important for all of us. We are not people, human beings don't tend to sleep longer than they need to. So if you are one of those who needs more than 10 hours of sleep, that might be because of an underlying medical condition, and that needs to be checked out for sure. We cannot expect our heart rate to work fast for a certain time and then to just be slow. Definitely not when we are sleeping, but other times. Our heart cannot just say that I'm going to work harder for 2 days and rest for 2 days. Similarly, our bodies really we cannot say that we are going to get 4 to 6 hours of sleep during weekdays and catch up on our sleep over weekends. That's just not how our body works. We want to have that consistent sleep routine and make sure we maintain it over all the 7 days of the week. If I'm a great sleeper and I can sleep anywhere, anytime, that's also not normal. So some of the other red flags are mundane activities where we are not really stimulated, active, such as reading in the afternoon. If you tend to drift off when reading in the afternoon or in a meeting or in a passenger seat when you're not driving, that shouldn't be the case. You should be able to stay awake even when you're bored. And so if that's the case for you, then you want to make sure that you're sleeping well in the night. Okay. So let's look at the sleep cycle and how does it take place. There are 4 main stages of sleep, from our awake state to stage 1, stage 2, and then there is the stage 3, which is a deeper stage, and our famous REM, or rapid eye movement stage. Now, stage 1 and stage 2 are light, and we tend to spend almost 50 to 65% of our time when sleeping in these 2 stages. So even though we consider deeper stages of sleep and REM as more important, there is a lot that's happening in these lighter stages of sleep, and so we do not want to underestimate its benefits on our body. Now, we talked earlier about when we consolidate certain memories and we are trying to make that stories in our head. That happens in second half of our sleep. So in the first half of our sleep, we are really using up all the nutrients, the good food that we eat, the exercise that we get towards repairing our muscles, to taking care of wear and tear in our body, the physical aspect of it. And so if a lot of my clients that are trying to lose weight are eating perfectly well, are exercising regularly, and are still not seeing the weight loss, we definitely consider looking into making sure that they are sleeping well. Otherwise, all the good work that you do in the day is not really put to good use in the night. If you're not getting that rest, you're not really seeing the benefit of your hard work. The second half of our sleep is when we are creating those connections, when we are clearing out the toxins in our brain, when we are problem solving. This is also the stage when we are dreaming, and that's where that rapid eye movement comes into play. If we are sleep deprived, this is the part of our sleep that we are compromising on. So for people who tend to get 6 hours of sleep in the night, you're really not getting enough time to dream. You're not really getting enough time to consolidate memory, to put into, or rather understanding your new learnings from the day. It is especially important among youth because and students, if they are not getting enough sleep, then they are not really grasping what they are learning through the day at school or college. So for all of us, those 7 to 9 hours of sleep is really vital, and getting that second half of sleep is also equally important, and it can play a big role in avoiding depression and emotional imbalances, and also in avoiding Alzheimer's disease over a period of time. Now, for some of us who we have life, things get in our way. We cannot always get those 7 to 9 hours of recommended sleep. And should anything get in your way, napping is an important way to make up some of the lost sleep. Now, I used to pride myself as well as not being a napper. I don't need it. I can go through the day without sleeping. But once I learned how important it is, and I realized that there were times when, especially days when I've had an intense workout, my body needs that 20 minutes of nap. It's a power nap that you can take, and in this phase, within those 20 minutes, you're just in that first and second stage of light sleep. You might be aware of your surroundings, but at the same time, when you wake up after those 20 minutes, you're way more rested, and you can go through the rest half of your day without having to drag your feet. So if you are one of those who wants to just experiment if that nap really does wonders for you, I would strongly encourage you on days when you're feeling really tired, instead of trying to have that coffee right after lunch when you're feeling a bit drowsy, maybe take that 20-minute power nap. It might make a world of difference to you. Now, it takes us around 90 minutes to go through all the 4 stages of sleep. So if you are if you have had really compromised sleep the previous night, and if you have the time, taking that 90-minute nap might be also helpful to you. Ideally, you want to take that nap between 1 to 3 p.m. so that your nap doesn't impact your night sleep. A common question I get is, how much sleep do I need? This table tells you exactly the hours of sleep that you need based on your age. Okay? All right. So some tips for good night's sleep. You want to maintain the same sleep routine every day. Exercising regularly can help you get very good quality of sleep in the night. How you spend your day decides how you spend your night, and vice versa. So you definitely want to get that good exercise. Avoid screens 30 to 60 minutes before bedtime. Avoid caffeine. Now, by the way, caffeine can come from tea, coffee, soda, a lot of energy drinks. So be mindful of all of those 6 to 9 hours before bedtime. Temperature in your room can impact your quality of sleep. 65 degrees has been found to be an ideal temperature for good night rest. Keeping your room dark, again, avoiding all light, allowing your body to create its own natural melatonin is important, as well as keeping all your gadgets out of the room. Thank you for your time, and I'm happy to answer any questions.
That was great.
Hi, Mita. This is Jyoti.
Hi, Jyoti.
Hi.
Yeah.
One question that I have is, does it matter from what time to what time we sleep? Like, for example, there are people who go to bed at 9, right, and get the requisite 8 hours or 7 hours. Mm-hmm. And there are people like me who sleep later, midnight, sometimes past midnight. I do get the required number of hours, but obviously that's not normal pattern for a lot of people. So does that matter?
Yes. So it has been found that our highest drowsiness, our sleep, is between 12 to 2 a.m. and between 3 to 5 a.m. So you definitely want to get those hours of sleep. So if you're one of those who is sleeping at 1 and waking up at 10, then you're not really respecting our body's need for sleep during those hours. Okay. So you can, other times you can adjust. Maybe you can fall asleep at 10 or 10:30 or 11, but you don't want to compromise those two timings of sleep.
Okay, got it. Thank you.
You're welcome.
Mita, Carissa says she wants to know more about the connection between poor sleep and inflammation.
Yeah, so when we are not well rested, there are certain hormones that are triggered, or there is higher production of those hormones that lead to inflammation in our body. And so people tend to have higher levels of those hormones when they are not well rested. Carissa, did I answer your question?
Okay.
Yes, thank you so much.
You're welcome.
Amit says, off late he's finding that he sleeps and gets up early, typically getting about 6 to 7 hours a night, but then takes a nap of 1 to 2 hours during the day, afternoons or early evenings. I feel great, but any thoughts on getting your 8 hours of sleep during the nights versus spread over 24 hours?
Yeah, so there we do have some research where taking that nap in the day has been, in fact, 1.5 to 2 hours of nap during the day can have as much benefit for your body as 6 hours of night sleep. So getting the recommended hours is definitely helpful. It can help you. Now, people do vary in their sleep cycles as well. So not everybody is able to sleep those 7 to 9 hours at a stretch. So a person like you, if you are able to get those 6 to 7 hours and can make up for the remaining hours during the day, that's fine too. I would say the aspect of taking that 1 to 2 hours of nap as equivalent to 6 hours of sleep in the night, you want to take that with the caveat, because we do not have enough research on the impact of this nap on certain aspects of our sleep, such as memory consolidation and clearing out of some of that toxins. We really don't have clarity on that at this point of time. So you don't want to use that nap as a way to make up for 6 hours of sleep in the night, is all I'm saying. To try to get those 7 hours in the night should be the gold standard. And then you make up for some of the lost sleep during the day.
Great, thank you.
You're welcome.
Jyoti asks if there's a prescribed over-the-counter medication that can be taken for a few days to establish a time pattern, or an essential oil.
I am not a medical professional, so I would hate to give you any recommendations on medicines. But Dr. Steve, I think Dr. Ralph has something to share.
So on, melatonin is your natural produce hormone, the pineal gland. So, taking a supplement long term will affect your body's natural production. But in severe cases, I'll recommend it short term. Short term being 3 to 4 weeks. If I have a difficult case of someone with a difficult case of insomnia, so it's better absorbed sublingually than orally, because orally it goes through the stomach and then into the liver, and that's called first pass metabolism. A lot of it is metabolized. So sublingually it gets absorbed directly into the bloodstream. So 1 milligram sublingually is a good dose. There's also that's one of the 5 supplements that during this time of COVID that has been shown to have some immune benefits as well. So again, I'm just recommending to patients short term through the spring, let's say, till we get through this difficult period. This is an unusual situation. Lavender, as far as essential oils, lavender has the most experience, so we actually put it in a mister by the bedside. I think you can even consume, I think there's teas with lavender. So that's, and there's some other natural, I can't remember. Valerian, I believe, is another supplement. I believe there's one or two others, I can't recall. As far as, I'd like to say there were two things I was just making notes, which I would offer to expand on. As far as, because I'm sort of interested in, one is the blue spectrum lighting that Mita mentioned with electronic gadgets and so forth. So if you look a little more closely, that frequency of light is called the cold spectrum, is around 6,000 K. So your fluorescent lights in the kitchen, a lot of your light bulbs can emit light in that spectrum. If you look closely at light bulbs, at the packages when you go to the store, there are bulbs that are warm spectrum down around 2,500 K. They look the same as another light bulb. It's hard to tell from looking at them. You have to look at there's a little table in the back with what spectrum. So we have them in our bedroom, and they come in a brighter bulb and a less bright. It's not the brightness of the bulb, it's the spectrum of the light. I think something that Mita said, I'll just reinforce, that your TVs are all blue light. So you really, want to avoid looking at TV. People that have a lot of difficulty sleeping, I tell them to really have to shut off the TV like an hour before bedtime, put on some background instrumental music that won't distract you. If you're awake for more than 30 minutes, having difficulty falling asleep, they recommend you get out of bed and do something else. Read, do a crossword puzzle, jigsaw puzzle. Don't reach for your phone or your computer, as tempting as it might be, but some other distraction so you feel tired, and then go back to bed. The other thing, I was making notes while you were speaking, it reminded me, I can't tell you how many patients I've seen that come in and say, well, I have ADD. So what do you mean I have ADD? Well, I can't focus. My memory is bad. So when we peel the onion away, sort of, so to speak, is the expression I use, and that a psychologist told me, when you peel that onion away, very often it's sleep deprivation with layers of depression on top of that. That's been the most common cause of lack of focus and memory difficulties. So, for those people that are Googling and self-diagnosing, and everyone wants to say ADD, but those are the things as I was making notes. So,
thank you.
Okay. Okay.
Yeah, appreciate that.
Very helpful, thank you. And guilty as charged with a lot of things that were said today. What to eat, to go to bed, ADD, yeah, a lot of us say that.
Yeah. Any other questions?
Yeah, and lack of sleep, I never can pronounce the hormone that's associated with obesity and weight gain. I think it's ghrelin, G-R-U, ghrelin, L-I-N.
Mm-hmm.
It's underappreciated, but it's a factor in weight gain as well.
Yeah.
Yeah.
And thank you, Dr. Ras. That reminds me of one more study that was done among teenagers, high school students, and 1 in 5 of them today is identified as ADD. But in most of the cases, it is lack of sleep. So once they corrected it, the number of ADD diagnosis was significantly reduced. So thanks for reminding that.
Yeah, that is a bit of a catch-22. I have teenagers in my home, and getting a disciplined sleep routine seems to be an impossible to achieve goal over here with them. And I hear that it's common amongst, most children. Again, COVID has added a level of challenge to that, but
it's a challenge for all of us, and I'm not immune in our home as well. I hope my wife's not listening. So no, none of us are immune to.
All right. This was great, Mita. Thank you, and thank you, Steve, for all the information that you provided. We did have a recording. I know I messed up in between, Mita. I paused the recording because I couldn't tell if it was recording right. But we will put that together and post it and share it through YouTube and all the channels. So thank you, everybody. You know where to get a hold of us if you have any more questions. Dr. Ralph is also part of our group, so any further questions, we are all available. Thank you.
Yes.
You're welcome. Thank you all. Welcome, Geeti. Bye.
Okay. Get some sleep.
Bye.
Bye.